My poster is entitled Breastfeeding Education for Nurses in Rural Rwanda. This poster encompasses an initial visit and a 4-month follow-up visit to the neonatal unit of a small district hospital in rural Rwanda. As background information, a foundation of effective breastfeeding is essential for an infant's survival. Without adequate breastfeeding, infants are at higher risk for infection and mortality. Efficient breastfeeding skills are developed in the hospital and require the efforts of the mother and the infant, plus the integral support of trained nursing staff. Nursing support is especially important for infants who are separated from their mothers at birth due to prematurity or illness. In these special circumstances, nurses are central to reducing the risk of infections and mortality. They teach mothers how to express their breast milk and later how to correctly attach their infant at the breast. A nurse armed with knowledge possesses the tools needed to create a positive breastfeeding experience for both the mother and the baby. It was identified that nurses in this rural Rwandan hospital were not equipped to teach mothers how to effectively breastfeed or express their breast milk because they had not previously received education on these topics. All of the nurses in this unit expressed a desire to learn about all of these topics. This project was completed in an effort to empower nurses to apply their knowledge through maternal education at the bedside. This quality improvement project began with a 10-day observation period to identify the unit's needs. A pre-training assessment was done during that time to gather demographics and identify the participants' preferred learning methods. I also administered a pre-test to identify the participants' knowledge about breastfeeding and expression of breast milk. Education was developed based on a WHO program and the AAP's program entitled Essential Care for Small Babies. I taught 8 participants about breastfeeding and expression of breast milk, utilizing discussion, observation, and simulation. Printed materials were produced in English and in French, and they included nurse handouts, a parent teaching sheet, and a simulation checklist. The picture in the middle of the poster is from a simulation session using a breast simulator, or breast vest, as we called it, created by a local tailor to be worn by the simulated patient in an effort to create a more realistic experience for the participants. A post-test was administered to participants immediately following teaching and then again at 4 months post-education to evaluate their knowledge retention. I led a focus group during the follow-up visit, which included all 9 staff members in an effort to explore the participants' perspectives of the training they received. During my 3-month absence between site visits, education was reinforced when participants watched 2 videos and answered related questions about breastfeeding and expression of breast milk. They also completed a parent teaching form where they recorded their application of knowledge through educating mothers about breastfeeding and expression of breast milk on admission. The results indicated that nurses' preferred learning methods were simulation, reading, and videos, so all methods were integrated into the education. The bar graph to the left indicates the patient's knowledge assessment results. The pretest assessment was depicted using the blue line, the orange line indicates the post-test knowledge, and the gray line is at the 4-month post-education follow-up. In areas of deficits, participants showed a 47% increase in knowledge following education. The gray line does indicate there was about a 7% decrease in knowledge at the follow-up visit. The pie chart at the bottom of the page indicates the parent teaching forms that were filled out on admission of a baby to the neonatal unit, which indicates maternal education of breast milk, or breastfeeding and the expression of breast milk. These results show that 72% of 132 mothers received some form of education about breastfeeding or the expression of breast milk. In the focus group, participants were unanimously appreciative of the education and the varied methods in which it was presented. Multiple participants said the mothers found it more comfortable to breastfeed and express breast milk following the nurse's education. The nurse also identified time to be the greatest barrier to teaching mothers at the bedside. In conclusion, the participants' overall knowledge did increase. Nurses were receptive to learning in accordance to the preferred learning methods and especially enjoyed simulation. More mothers were taught breastfeeding and expression of breast milk technique following the participants' education. There is potential for future projects at this site related to infant feeding, application of knowledge at the bedside, and basic care of the premature baby.